A little bit of time, let everyone jump in who are still lagging in the waiting room. It's really great to see you. We're really happy that you're here. All right. So as people keep filtering in, I think I'm going to get us started, just moving along. So welcome to Building Patient-Centered Care in School-Based Health Centers, supporting student transitions from pediatric to adult health care. We're really excited to have you all here. Like I said, I'm going to jump right into our reminders and some housekeeping very quickly. So, just a few quick things to say. You can hear us, but we can't hear you. So just to help streamline questions and make sure we can kind of get to as many as possible, we've turned off the chat and we'll instead be utilizing the Q&A feature. So if you have a question during the session, you can hit that Q&A icon at the bottom of your Zoom screen, and then you can type your question in there. We also have a dedicated portion at the... Let me fix that. My apologies. Slides are having some difficulties. There we go. Thanks, everyone, for bearing with me here. So what I was saying is you should be able to use the Q&A icon at the bottom of your screen to select that. You can type your questions in there. We do have a dedicated portion for that at the end of the session. So to turn on closed captioning, you can click the CC button. It might be different depending on your version of Zoom. So it could say closed captions or just that CC, but it should be there. And then we ask that you complete the evaluation poll that's at the end of the presentation. That really helps us kind of compile what's happening in the field, what people want to know, where everyone is at. And it's really beneficial as we kind of report that to our funder. So I also, as we're going through, I'm going to let our today's presenters introduce themselves. So as I said, I'm Donnie Greco, and I will pass it over to Addie.
Hi, everyone. So glad you're here. Thanks for joining us. My name is Addie Vanswell, and I'm Vice President here at the School-Based Health Alliance. I've been here for about 3 years, and prior to that, I worked as a clinician and manager of behavioral health at a school-based health center in Illinois, just outside of Chicago. Teresa?
Great. Welcome to you, whether it's good morning, good afternoon, wherever you are calling in from. Excited to be with you all here today. Teresa Dominguez, Director with the School-Based Health Alliance. I see some familiar names of folks that I've worked with, but I work with sites throughout the nation to support the great work they're doing on the ground. And I had the pleasure of running school-based health centers in Florida prior to my work with the Alliance.
Great. Thank you so much, Teresa and Addie. We also have another presenter who I'll let her introduce herself in a little bit. But just to kind of set some background, you might know who we are, but if you don't, we're the School-Based Health Alliance, which is a DC-based nonprofit founded in 1995, serving as the national voice for school-based healthcare. So our board of directors kind of reflects a wide variety of perspectives from across the country, including health center and hospital leaders, state and regional partners, national organizations, school professionals, community partners, and youth representatives. So this work is supported by the Bureau of Primary Healthcare, and as a National Training and Technical Assistance Partner, or NTAP, SBHA provides training, technical assistance, and resources to support those school-based health center programs nationwide. At its core, the school-based healthcare brings services directly to students where they spend the majority of their time, which is in school, and also helps them to support their overall well-being. So just for a little bit more grounding in terms of today's learning objectives, we hope that by the end of the session, participants will be able to define patient-centered care in the school-based health context and identify strategies to engage students as active participants in their care, explain how school-based health centers can support students in developing skills to manage their own healthcare during and after high school, and then apply the GOT transition framework to strengthen or develop transition practices within their school-based health center. And with that, I will pass it back over to Teresa to kind of walk us through the session overview and get us started with content. Teresa, please take it away.
Thank you, Donnie. So why are we all here today? We're here to think about transitions for our students. We want to understand, we want to help you all with that understanding so that when your students graduate, they are going off and transitioning into the sunset and you've already made that connection. We're going to go through some examples. We're going to have a little bit of discussion and go into next steps. So on our next slide, let's talk about why this matters. Why is this important? You can ask yourself that. Why is this important? What is your why that made you come to this call today? Why is it important for you to help those students through those transitions? Well, thinking about this bigger picture, we like to remember that being able to allow students to continue with that care that they're receiving now at their school-based health center so they can continue to be healthy adults even after graduation. But we also want to think about how do we support students during this transition as they go from one grade to the next? How do we help them to be able to support them as well as their families to be able to have the care that is so important to keep our students healthy and in their seats at school. So thinking about our next slide, we'll go into, let's talk a little bit about our littles. What's important? Seeing students as the primary patient. I know it's a transition, it's a little bit different. Thinking about how we put our students first and they're the primary patient. You know, the parents, guardians, caregivers, they're part of this bigger picture, but making sure that we have our student as a primary patient is important. Thinking about how we ask the questions. Do I speak to the student or do I speak about the student? How do I involve them in their care plan? What does that look like? What is that bigger picture? Building that direct communication and having that shared decision making with children and youth is so important to really being able to create that that transition at the end because they're a part of their own care. Going to the next slide, thinking a little bit about how do we work with students and families? So being in a school-based health center is such a unique place, but it's nothing different. Just like you would be if you were in a doctor's office that's a brick and mortar that you're going into there, as opposed to having your school-based health center that's connected to the school. It's the same thing. You're going to have your students and you're going to have your family still involved. But thinking about how do you clarify roles? How do you provide that family education? How do you work through the system to really make sure each member of that team, which we have the student and their family, are informed and ready to make that difference? They feel like they're able to move forward to be able to support the needs of their student. So thinking about how can we do it? How can we modify what we're doing? Thinking about our parents, guardians, or caregivers' schedules. Thinking about, is it a phone call? Does your office have video capabilities? What are they? Are they a night shift worker, or should I be calling them at the end of my shift to involve them in their students' care? Thinking about working to identify the best time to connect with that parent or that guardian or caregiver, and then also thinking about how do you ask those questions and involve the families, thinking about availability, again, thinking about how we work together to achieve the shared outcome. So again, engaging the students and families are both part of a successful plan. So I want to go on to the next slide and think about child development. We're going to let's walk down memory lane and think about when you were developing as a child. This is age like 5 to 10, elementary school. You're out of the house, you're off to school by yourself. What's important as they're in that space, especially thinking about how do we set them up for success? So think about it. We want to introduce the school-based health center. This is a new place. It's safe, it's supportive. Think about encouraging your students. How do we bring them in, help them understand what the school-based health center is here to help them do? Think about how you're making it normal for them to be able to ask adults for help. And then thinking about the type of conversations we're having with our students, making sure it's age appropriate, 5 to 10. So think, build comfort and trust. 5 to 10, that is what's over ahead. Again, we're walking down memory lane. We're going to go on over to middle school. Middle school, age 11 to 13, approximately. We want to build that awareness and skills. We want them to build the skills. They're growing that independence. They're in school. They're able to move around to classes depending on your school system, and thinking about how that aligns with the school-based health center. We're teaching the students to describe the symptoms and the concerns. We want to help them build that vocabulary and to be able to help speak about what they're feeling, what they're going through at that moment. We want to encourage them to be a part of the visit, help them with the decision making, and then again, reinforce trusting adult support. Again, we're walking down memory lane and we're right to high school. Graduation's about to come. Ages 14 to 18 plus, I say plus, depending on your school district, will depend on when your students, what age that goes to. So I'll say 14 to 18 plus. So building independence and readiness, they're almost ready to walk across that diploma and have walk across the stage and have that diploma in hand. So thinking about what that looks like, building independence and readiness. You want to make sure that they have those skills to be able, after graduation, to be able to support their health. So think about engaging your students in that transition, that planning, having those conversations. So every visit, you're able to utilize that visit to what? Build independence and readiness. You want to teach them skills, come in and make your own appointment, making sure you can do that. Understanding the medications, you know what medications you're on, refill requests, follow-ups, insurance, them understanding what insurance looks like and what is it? What do you do with it? What's the role? Think about helping the students lead part of the visit. Hey, I would love to hear what are your concerns today? Asking them, letting them have that conversation with you, and then prepare for that handoff. So it's not just a diploma they're getting at the end, it's being able to get into that adult care so they can go off and be in society, but also have health care. So thinking about tools. So here we are. We went through their whole lifespan. It was quick. I know it was fast, but we have a lot we're going to share with you all today. So one of the tools on the next slide you'll see is Introduction to the GOT Transition Framework. I won't give it all away, but I'm going to break down the 6 core elements. Thinking about why this is important, it's a structured, evidence-informed model for supporting youth as they transition to adult care. So you may have said, this all sounds good, but this is not how it works in my clinic, or it may be a little difficult or missing a piece. Don't worry, we have a tool for you. So on the next page, I'm just going to go through the 6 core elements really quickly, and then we'll get into them a little bit later. So starting from the top, think policy guide, having a way that your staff, those working in the school-based health center, understand what is it that you all are aiming to do, and then having some tracking and monitoring, going into readiness, planning, transfer of care, and then boom, we have graduated, transition completion. So we have gotten them to next step. So if we go through that model, we're going to do it again, go through the child development, go through memory lane again, and now break it down for healthcare transition timeline. So again, going back to our 12 to 13, thinking about supporting the student in learning about their health condition, medications, allergies. So those 3 buckets there you see, supporting them through that space. And then thinking about supporting the student by providing opportunities. So giving them an opportunity. What is your SBHC, what is your school-based health center currently doing with this age group? That's what I want you to ask yourself. Ages 12 to 13, how are you giving that age group something to help with that transition? Have you been able to support the learning? Is that something that your site is actively doing? So ask yourself questions. I know we're going through a lot today, so I would say jot down a note, ask yourself, this is something to bring back to your greater team so that you can look at that. If you're not serving 12 to 13, put whatever age group you're in. What are we doing now to help with transitioning for our students? Next, we move into ages 14 to 15. So think about, again, how do students know, find out how students know about their health, healthcare, and family medical history. So what does that look like for these students? Again, supporting the understanding, and then next going into engage students and making appointments, having them facilitate that process. So thinking about whether it's phone, online, or through an app, being able to give that to them so they're able to help. They have their hand in being able to move forward. So again, think about, if that's not the age group you're working with, thinking about how you can work through each of these stages to better support the students that you all work with. Next, we go into ages 16 to 17. So think about how do you ensure the students or provide the conditions to be able to do that? How do we make it successful for the students? So we want them to be able to have their appointments, communicate questions. Is there a method? Is there a space that they're able to do that and to feel safe as well? Thinking about what are at your local as well as your state laws in regards to what students have the ability to do based on their age. And again, we always know in school-based health centers that students are and families, caregivers are all a part of this bigger picture. So thinking how we move through this process and how we continue to engage our parents, guardians, and caregivers to really support that upcoming transfer. All right, so we're moving through quickly again on to age 18 to 21. The transition students to new adult provider, we've got there, the diploma is almost in hand, or maybe they graduated at 17. Right in there, we're in that great spot in the middle, making sure they have that documentation. They have been connected to that next person, making sure the next office, making sure they have updates in the system and they have what they need to be successful to be connected to that new provider. Making sure you review any additional changes with that with the student, and making sure they understand that anything that would change as far as any changes that could impact them past 18. So next, I'm going to hand it over to Addie, who's going to get a little bit more in depth with the areas that I just talked about. So over to you, Addie.
Thanks, Teresa. I appreciated the trip down memory lane. So as she mentioned, I'm going to talk a little bit more in depth about the core elements. And again, these core elements did come from Got Transition. And I put in a couple links in the chat. So SBHA created a toolkit a while back that is available to you. And then I also put their general link in the chat as well, just to dive in. It really does dive into the applicability to school-based health centers, which sometimes we need to adapt and adjust. And so I would really encourage you to take a look. So this first core element really looks at that transition policy. So what does your school-based health center say about healthcare transition for students and their families? So it really does kind of align with supporting that transition from pediatric to adult care. So every student, we believe, deserves a successful transition. It can be really, the healthcare system can be really intimidating. And so what we can do to educate people from a very young age to get to those adult healthcare systems can make it a little less scary. So we really want to make sure that this is a positive experience for people. But you want to make sure that you include kind of the roles. So like what students, families, and the health center staff, what they're responsible for. So it's very clear. Um, when information changes, so different states have different laws related to confidentiality and consent. And so making sure that students and families are aware what changes at age 18 or sometimes younger, and then how information is shared, and how, you know, you want to make sure that everybody that you're working with, whether that's your staff or your students, are well aware of your transition policy and review it on a pretty regular basis so that you know it doesn't just get filed away. You can take a look at that maybe once a year to see are there any changes we need to make based on your kind of integration of the transition care. So if we can go to the next core element, this is really looking at, and I think this might be the hardest part in some ways, right? So like identifying the students who need the transition support, and track the progress through key transition steps. So here, this is where, and I think Teresa did an amazing job talking about how you can start these conversations early. So, starting with the littles, there are things you can do. But that when we are really talking about transition from pediatric to adult healthcare, we're really trying to prime and get ready our high schoolers, ready to kind of take those next steps. And so, you may use a registry, there may be things in your electronic health record that allow you to track this. I think some health centers will use some Excel spreadsheets, like whatever you need to do to be able to kind of track where your students are is great. And then you're going to want to monitor that progress. So you're going to want to see, like, okay, where did readiness assessment? Are we in the active planning stage? What referrals need to be made, right? So use that tracking to help really guide your outreach with your individual students and families that you're working with. So moving along to core element 3, I just mentioned the readiness assessment. So there is kind of an already done assessment that you can pull from the Got Transition website, and it looks at kind of where the students' strengths are in terms of self-management, in terms of looking at how like do they know how to call the doctor's appointment or doctor's office and make an appointment? Do they know how to go to the pharmacy and pick up their prescription, right? And so it asks a series of questions, and it really assesses where they're at. And so that can really be telling as a provider to say, like, oh, okay, I really need to build on this health literacy piece right here because they're not on this assessment that they took. They're really demonstrating that they don't know where they're at. They don't know, how to make that next step to get to that appointment. So it really helps with identifying those strengths and skills. It also helps you identify some gaps where you can provide some coaching and resources to really help build their confidence. And then you'll want to kind of repeat those assessments over time just to kind of check to see, like, is there growth, right? And if not, then what do we need to do? Do we need to go back and do some additional coaching? Core element 4 does get into the transition planning. So this really is where you take the results from the assessment and you work with the students and families to support the students. So I think it's, always important to bring this up, right? As a mental health provider myself, I would you try to start early, right? You try to prepare students to realize, like, okay, after I graduate, I'm not going to be able to come to the school-based health center, and start talking about what that transition looks like, who they may be meeting with. And so you start those conversations early so it's not a big surprise. You can document your goals, your action steps, your timelines, and build in kind of just these key tools. So whether that's in like going through your medication list, or if there's a crisis plan that needs to be established, making sure that they understand what that crisis plan is and what it looks like and when to reach out for help. It's also a really great way to coordinate referrals and warm handoffs to adult providers. So I know with one thing that I did was that I would work with students. And if they needed ongoing services after graduation, I would try to get them connected in with a community-based therapist, and really would offer a transition session. I would, make some of those phone calls with the students, just so they felt more comfortable. So it's really important that you are able to provide some warm handoffs, especially when you're working with students that may or may not. I worked with some students that took a long time to trust me. And so by the time they were getting ready to graduate, it was like, oh, but like I told you all of my really personal stuff. Now I have to go tell somebody else. I'm like, yes. And we can, I have a person in the community who I know who would be great. Right. And so I think having those conversations and being able to have those direct handoffs and connections is really important.
And Addie,
Going
before we
into,
move on, I
yeah,
just wanted to ask a quick question. So is any of this
sure.
work billable?
hmm Is any of it billable?
Yes.
That is a great question. I don't know, Susan, if you have insights or Teresa.
We currently at our school-based health center are not billing. So I have not attempted currently to bill for transition of care. But oftentimes, like today, when I was seeing patients, there was two patients that I was discussing transition of care with, and I was seeing them for other things, and the conversation was part of the visit.
And then I'm gonna put in chat. The Got Transitions has a billing piece. So I'll put it in the question and answer space. So you all can see exactly how you would be able to do that. So great question and appreciate you all asking that.
Yeah.
Thank you
And
so much. Back to you, Addie.
yeah, thank you for the interruption. And figured they had a resource available, so I appreciate you getting that right into the chat, Teresa. And as Susan mentioned, it really is kind of this like natural discussion, right? Like as you're meeting with students, you tend to have these conversations about like, okay, what's next, right? And so you may end up billing for something else, but it is definitely part of the conversation. So definitely check out that resource from Got Transition for more information about the billing. All right, so for core element number 5, this is really looking at transfer of care. So this is really coordinating that handoff to the adult provider, make sure that the student has everything that they need, and that they're able to follow through. So I think sometimes in school-based health centers, we're very hands-on, right? And so helping them understand kind of what that model looks like as they transition into the adult care system. Um, Also making sure that they have all of the information that they need. Um, I think it's also a great idea to help them schedule maybe a first appointment before they graduate, right? So that way they can kind of come back and chat with you about like, oh, that went really well, or oh, that didn't go well at all, right? And so, especially from a behavioral health perspective, it can be sometimes our community-based providers have like waiting lists for a really long time. So this process gets started pretty early on. And then really, again, utilize those warm handoffs to reduce students and families from not receiving care. Um, all right. So next core element is the transition completion. So this is really where us as providers are going back and kind of checking, making sure that they followed through on that referral. So did they attend the visit? Did they feel supported? Is there anything that we could like asking them, like, is there anything we could have done to make this transition better for you? And then use that data to, um, you know, uh, drive quality improvement around what you can do better to help support students. Next slide. So as kind of bringing us full circle, healthcare transition as a developmental process, right? So if we can start early in terms of building that health literacy, naming the needs, asking the questions, starting to introduce some of those skills, in middle school. In high school is really when we get into that, kind of assessment and that action planning. And then before graduation, that's really where we're trying to do some like warm handoffs, coordinate referrals, and then follow up to see if the students were able to get connected. Next slide. So this is just another kind of way of looking at the timeline. So starting where Teresa started us right at that elementary level all the way through adulthood. So you'll see kind of those skills, you're building health literacy skills along the way through independence to navigation. And then you're going to continue to support the students and their families through not only that education piece, but the planning, getting them referrals, and then following up. And then at the very bottom, you can kind of see where the core elements lie, right? So most of them start at that like middle, but really more high school age and go on through adulthood. Next slide. So there are a number of implementation opportunities. So you can really integrate this into routine workflows. So um, as you're having conversations with students, it's really easy to say, like, have you thought about, especially if somebody has a chronic health condition, right? We want to make sure that they're connected so that they continue to receive care. So talking about like as you're managing their asthma, talking through, okay, well, in the adult provider, this is, you need to continue to you need to continue to have that managed in the adult healthcare system. Developing those partnerships with local clinics and youth serving organizations. So maybe your school-based health center has some community-based sites. So it's really just switching them over to an adult provider at one of those health centers. Um, do not reinvent the wheel. Absolutely use the existing tools. So earlier I had put in the GOT transition and SBHA toolkit. I think that's a really great place to start. And then really kind of track the metrics as much as possible to really look at that readiness completion and post-graduation connection rates. Next slide. So, would love to pause from talking for a moment to have you log on to Menti. So if you go to menti.com and enter the code 61789511. You can also use the QR code. We would love to see the answers to the question. So again, the question is, what mindset shift is most important when working with youth transitioning to adult care? Donnie, are we able to see some of the results at all? Awesome. So we want to take a quick moment to answer that question.
And while people are logging into it, I just want to make it really clear, like there's not a wrong answer here. We love to ask this for engagement, just to see where everyone is at. I know I myself sometimes have been hesitant, like, oh, I don't really know what to say. But honestly, that's kind of the best thing that can happen here because we get to see what everyone's views are, where they are, and getting those different perspectives. Addie, pass back to you.
Thank you. All right. Um, so meeting students where they're at, that shift between, being the provider and saying like, I know all of the things to really kind of coaching, right? To see what they know. Cause I think sometimes we get in this place where like, oh yeah, like we know all these things and we start off on a tangent when the student's like, yeah, I already knew that, right? And so like really checking in to see what they already know. Um, being open to new possibilities, allowing them to take ownership, empowering them to care for themselves. Let's see. Sometimes students have the basic skills to make a phone call, but an appointment is hard. And I think right now with technology, people aren't used to picking up the phone call. Even sometimes I'm like, do I have to place an order on like, do I have to call in? Like, I'd rather just place it online, right? And there are ways to obviously schedule appointments online. So, great. This is keep the responses coming. Love to see it. I think we can move on to the next question. So if you want to keep up that same Menti poll and just go to the next question. So how confident do you feel engaging youth differently than adults? So thinking about how engaging youth differently than adults in this kind of transition to healthcare. Got a little bit of a spread here from somewhat confident to very confident. This is great. All right. Well, again, feel free to keep them coming. Um, we love the information from you guys and really seeing you engage. So we appreciate you participating in our poll. At this point, I think the slides went away. There we go. So if we don't have anything else, I'm going to pass it along to Susan to have her introduce herself, and talk about what this looks like in practice. So thanks for being here, Susan.
Thanks, Addie. Hi, everybody. My name is Susan Buchel, and I am the director of the Loyola School-Based Health Center, and we are located in Illinois. And Addie asked me to come today and just share with you how we facilitate the transition of care. Next slide, please. First, I'm just going to start with who is in our school-based health center and then who we serve. Just a little bit about myself. I've been a nurse for 32 years and a pediatric nurse practitioner for the past 26 years, and I'm on faculty in the School of Nursing at Loyola. And the School of Nursing is who leads the school-based health center. We are a free clinic, as I mentioned before, and we have been around this is our 24th year in operation. We are located inside of a high school, and there's 3 other high schools in the district. And then we see some patients from some of the feeder schools. We'll see kids down to age 6, but we mainly see the high schoolers. So our transition process is mainly focused on the older adolescents that are graduating. And just so you can kind of get an idea of how many patients we see, we're a fairly small clinic. We have 2,000, like in 24-25, we had about 2,341 primary care visits and about 884 behavioral health visits. So we mainly see patients for, well exams, school physicals, sports physicals, vaccines, acute care, chronic care, et cetera. And then on the behavioral health side, we do behavioral health assessments, therapy, case management, and then we have a dietitian as well. Can you flip back to the last slide, Donnie, for me, please? Okay. So just so you can see our team, this is our small but mighty team. It's myself, and then we have a physician that comes in 4 hours a week. And then we have a full-time family nurse practitioner, a medical assistant that also serves as our front desk staff. And then we have a full-time dietitian and then 2 LCSWs that again see patients for further behavioral health assessments and therapy. Next slide, please. So like most school-based health centers, we are helping meet gaps in healthcare for the patient population that we see. In academic year 24-25, 52.9% of the students in the school and district that we serve were eligible to receive free school lunch. And in Illinois, that is higher than the state average. The state average was 49.7, just so you can get an idea of the students and patient population that we serve. Transitioning from pediatric to adult healthcare poses challenges for all adolescents, but especially those experiencing poverty, unstable housing, or lack of insurance. These youth are less likely to receive transition supports, and this increases their risks of care gaps in their healthcare. And evidence demonstrates that structured transition programs in school-based health centers really helps to improve overall health outcomes and the continuity of care. Next slide, please. So why transitioning planning matters? Why does it matter? Every adolescent will eventually move to adult care, and this looks different depending on your practice, your school-based health center, the patient population you serve, the providers, et cetera. So it'll look a little bit different for everybody. Without structured support, transitions can lead to increased emergency room visits, medication errors, and lapses in care. Only about 17% of youth currently receive structured transition support, so there is a big need. Next slide, please. As far as guidelines, leading national organizations in healthcare that focus on children, adolescents, and families recommend early, proactive, and individualized transition planning. And I have a whole list here, the American Academy of Pediatrics, the School-Based Health Alliance, Society for Adolescent Medicine, the American Academy of Pediatrics, et cetera, et cetera. So many leading national organizations support this transition planning. Key elements include collaboration among youth, families, parents, providers, plus the development of self-management skills. Earlier today, I was seeing a patient that sees me on, for medical appointments, and then also sees one of our LCSWs, and we were talking about transition of care and that self-management part. We were starting to dive into, what does that look like? And I was asking about her primary care provider that she hasn't seen in a little while, and just trying to get a feel for what type of provider is that? Is it an adult provider? Is it a family provider? Is it a pediatric provider? So we were just starting to have those conversations, so she could begin to start to self-manage, reach out to a provider to make an appointment, et cetera. Next slide, please. So the role of school-based health centers. School-based health centers universally are trusted by adolescents and their families to provide integrated care. And evidence shows school-based health centers really promote continuity, especially for at-risk youth. Many serve as a medical home or collaborate with primary care providers. We don't see here patients in the community. Some school-based health centers do, but we often will see them during their high school years and then collaborate with primary care providers to get them transitioned. It's encouraged to integrate transition planning, such as using what Addie had mentioned, the Got Transitioned toolkit or AAP guidelines or other evidence-based guidelines or toolkits that are out there. The SBHA endorses and promotes transition guidelines and provides implementation tools and training. The resource that Addie had put in the chat is an excellent resource that I have referred to and that we use. And the key takeaway here is that there are lots of resources available. If you don't have a formalized transition to adult care process in place, just take the first step and start looking at resources, and just start implementing something small, and then you can build from there. Next slide, please. So the example of implementation at our school-based health center, we adopted a transition of care policy that Addie spoke about and is recommended. And ours is very simple. The toolkit, I think, provides examples, if I remember correctly. And we looked at the example and then came up with something very, very simple. The providers here identify graduating students on an annual basis, and how we do this is each discipline does this individually, because the social workers, for example, they may have their own caseload, and then the family nurse practitioner, she might have her own caseload, and then some of that crosses over, and then also with our dietitian as well. So our interprofessional team here, we meet weekly for what we call case review. And we will also bring patients that are going to be transitioning to those discussions, especially if they're being seen by multiple providers. For example, the patient I mentioned that I saw earlier today, she is somebody that also, as I mentioned before, sees one of the social workers for therapy. And so myself and that social worker will work together on her transition of care process, because she will need to be transitioned to a primary care provider and then also mental health care as well, and managing her medication, therapy, etc. So we'll work together on that. The transition is discussed with patients at their appointments, and the approach that we use is kind of staged. We begin the discussions, it's very individualized. We use a readiness question set. Addie had mentioned that too, the transition readiness assessment. We use a modified version of the 6 core elements of healthcare transition from Got Transitioned. I would encourage you to look at that. We use just a 1-page assessment that our students will fill out. And we kind of look at that assessment with an individual lens, and then begin that process of transition. And some students, may not need a lot of support, and other students may need a lot of support, and it might take quite a bit of time to transition them, and they might need quite a bit of assistance. So in addition to the transition readiness assessment, we also have a transition of care packet. And in the past, we used to print this packet out, and then we'd find them all over the school. So we don't use money because we're a free clinic. We don't use money to print those anymore. If somebody asked for it, we would print it. Sometimes we print parts of it, but we have QR codes for the students and parents and families, and they can click on the QR code and it leads them to the complete packet that they can then utilize whenever they would like to utilize it. We also have a letter that parents will receive, students will receive, that we would like to, have them go through the transition process. And then in addition, they'll receive any referrals that are necessary. Just to go back to the packet that we have, just so you can kind of get an idea of what is in our packet. I'm just looking at our table of contents here, and it contains facts about transitioning, health insurance as an adult, information about getting an Illinois ID card if they don't have that, vaccine information, how to apply for benefits. It has a list of primary care clinics, dental clinics, vision, mental health clinics, mental health hospitals, therapy resources, reproductive health resources, immigrant resources, housing, nutrition, food security resources, and then other local clinic information. So it's pretty robust, and it provides all of local information that we have. And with this packet, we look at it annually and try to call all of the numbers and all of the contacts and make sure that those resources are up to date annually. And all steps of our transition process are documented in our electronic health record, or if we're paper charting. And then we also have our transition of care spreadsheet. So we use very simple, like Addie had mentioned, some school-based health centers might have, a very robust system. Ours is very, very simple. So if you don't have something in place, you can follow our example and start small and just use an Excel spreadsheet. So that is what we do. We put all of the information in Excel, and we start there. When we're first looking at all of our patient loads, and we're trying to see who needs transition of care, we add them to an Excel spreadsheet. When we meet for our interprofessional case review, we look at an Excel spreadsheet. So we keep all of our notes, the process, and whatever we're following through with referrals, warm handoffs, etc. We keep track of it on those Excel spreadsheets, and we look at them often. Every week when we do case review, we're looking at them, we're reviewing them until we can then, we have a system where we're kind of not crossing them out, but changing the color to they're completed. We also try to make sure that in the school that all students that are seniors or are leaving the school, transitioning out of the school, have access to the packet, even if we've never seen them in the school-based health center. We feel like the information is important for all students. So I usually work with, as the director, I work with the parent coordinator in the school to try to get that out to all of the parents, all of the students before they leave. And we do that annually as well. So again, I think I mentioned this already, but our policy, our transition of care packet and data, we try to review it annually for quality improvement. And we are far from having a perfect system. And so every year we make changes, we try new things. Sometimes they work and sometimes they do not work. So I encourage you, don't be afraid to try something and see how it goes, track the data, and to be able to inform you, hey, did this work well or did it not? Next slide, please. So some barriers and challenges that we've experienced. I'm sure all of you experience many of them in community health and school-based health centers. We do wonderful work, but oftentimes it can be challenging, right? So as you saw in the first photo, we have a limited staff. So that can often be challenging. Also training, in transition of care, that it's something that we have taken the time to do, but that can be a challenge and was a challenge initially. And then the capacity for added workload and added time to appointments. Also with our students, student engagement, sometimes there are students that we don't really see regularly. We may have seen them for a sports physical and that was all. They're often like, well, why do I need to come back there? So trying to engage students sometimes can be a little difficult, especially those that we're not servicing on a regular basis. And then caregivers, guardians, parental engagement. Sometimes there's challenges trying to get parents the communication with the parents due to work or limited resources, and they might have their own challenges, but we do have a letter, we reach out to them. There's multiple ways that we get in touch with guardians, caregivers, parents, etc. And then insurance issues. Many of our patients, there's a lack of insurance or they've let their insurance lapse. And then also sometimes barriers to referral sources because of insurance. Confidentiality issues can also come into play when we're talking about reproductive health, sometimes mental health, etc. We also have found out that these conversations need to start early. Again, when we're talking about transition of care here, we're transitioning our seniors or those that might be moving or leaving the school. So we're doing this their last year of school here. So there have been years where we weren't on the ball and we didn't start the conversations early, and then we had more complex cases and we didn't do the greatest job of transitioning those patients. So starting the conversations early, making timelines, having deadlines is very, very helpful versus trying to chase down students over the summer. The other thing that can be challenging in that area is sometimes if you're starting the conversation early, the students aren't ready to have the conversation yet. As Addie had mentioned, some of the students, it takes a long time to get them to trust you and, really confide in you. And then it is a loss for them when then we're trying to transition them on. So sometimes they're not ready to have those conversations yet. So sometimes that can be a little bit of a barrier. And we try to mentally turn that around, right? And empower them to really take control of their own health care and advocate for themselves. Health literacy can come into play as well. We really try to make sure that we have everything in a language that is preferred, and then also at like a 4th to 5th grade reading level, we try to make sure all of our resources are there. And then referral network. This can be difficult. Again, it's something you need to continually look at your referral network, continually reach out to those resources to make sure that they are still available. I feel like warm handoffs for the adolescent population are really best practice if you can do a warm handoff. So I would highly encourage people when they have some downtime. For us in the summertime, there are a couple weeks where there is some downtime. We usually try to reach out, make connections, have phone calls with other providers in the community so we have a continued robust referral network and can do warm handoffs. Next slide, please. So lessons that we've learned, again, I mentioned before, we are always reevaluating for continuous quality improvement. I would highly encourage you to start small and expand. When we initially started, we started with a few questions we're certified by the Illinois Department of Public Health. And when our reviewer came out, they made some suggestions and, we implemented those. So we started small and then we started looking at more resources. For years, we've been giving out our transition of care packet, but we weren't necessarily documenting questions that we were asking, and it wasn't a standardized systematic set of questions. So that's what we kind of focused on, really trying to have a systematic process that we follow and track it as well. And so, as I mentioned before, we now use the transition readiness assessment. I would suggest using a readiness assessment, even if you're partially using it. Like if you say, we only have the bandwidth for 5 questions, then choose 5 questions that are the most important to you and your patients and their transition of care. Adapting evidence-based guidelines to fit your patient population needs. And then, as I mentioned earlier, building relationships with adult and family medicine providers so you can do those warm handoffs. Transition packets, consolidating resources. Again, ours has, dental, vision, health insurance information, et cetera. Yours might look different depending on what you find your patients are in need of, especially when they are transitioning to adult care. And then annual review is essential, tracking data, student outcomes, using feedback. And again, it can be simple, so don't get hung up on that. Team communication and partnership are key. Next slide, please. So in conclusion, transition support is vital, and school-based health centers are uniquely positioned to help bridge gaps with structured evidence-based approaches that benefit youth families and health systems. That is all I had. Any questions?
Thank you so much for that, Susan. I really appreciate it. Thank you, Addie and Teresa. I think because we're kind of quick, a little bit short on time today, we are going to move ahead. However, there were a lot of questions submitted with registration. We will follow up with you and make sure that we kind of have all of those answered in our posting. I know a few of them were covered, but don't worry. If we haven't gotten to it, we will get to you. Again, that will come out within about a week. So we also have just like the quick thing for the next steps, which we can highlight again in that section. And then before you all leave, I would really be appreciative if you would able to complete our Zoom poll. As I said earlier, this is so helpful for us when it comes to understanding where are we at, where we need to be, what that looks like. So if you could just take a second to just answer this closing evaluation question. And while you do that, I'm just going to do a really quick overview too. We are having a conference this year, the School-Based Health Alliance is. It is in DC. I'm really excited. It's, back in person. We're, back together. It's a great opportunity for us to see each other, connect, sort of meet new people. I know I meet new people every year and learn something new every single day. So if, you'd be interested in that, please go to our website. I will also include that with the list of links and resources that are passed out because registration is open now. And Again, please stay connected with us. We will happily follow up with our social media and all that as we kind of send in those final things. So thank you everyone for attending today. We really appreciate you being here, and thank you to all of our speakers. You did a fabulous job. And with that, after you finish the closing evaluation poll, that's all we have for you today. Thank you so, so much. If you do have other questions that you didn't initially ask during registration, when that follow-up email comes out, you can be able to respond to that, and we'll field them to the correct party. All right. Thank you all so much and have a great day. Bye, everyone.